Well, good afternoon, everybody. Thank you very much for the opportunity to speak. And I'm so humbled after listening to guys speak that I'm a little speechless, which is never a good thing when you're the last speaker. That being said, I just wanted to first off, offer my sincere gratitude to Katie Caldwell and to Haley York, Tracy Fossum, as well as Guy Felicella, who just bared their souls to all of us this weekend and did so with so much grace and compassion. And it just warms my heart. We need to hear your voices. I don't say that enough. Some people may think I say it too much, but your voices make us stronger. So thank you all for what you're doing and how you're supporting our community. We need that. So on to my story. And I want to start off with an idea, something that I'd like for everyone to think through. I know we all know the concept of a toolbox and we've all used it. And, how many tools can you put in your toolbox? And I want to challenge this community because I think we're at that point. This weekend has shown me we are at this point that we need to stop calling it a toolbox. We're all going to start calling it an industrial sized garage because that's what we have now. We have so many options. We have so many choices. We're not done creating options and choices. And those of us as practitioners, those of us as individuals with lived experience, those of us that are caregivers, families, friends, we're all in this together, and your ideas, your solutions, they all matter and they all need to be in that garage. So that's my one starting sentence, if you will. And I go into my story wanting to provide my situation as an option or a choice. We need to think about these as options and choices. What works for me, as we've said a million times this weekend, isn't going to work for everybody else, but it should be an option and it should be a choice. So with that said, as you can see, I've got 20 years of coping behind me and dealing with pain and pain management. Very competitive individual and did that athletically through to my varsity years, at which point, not while I was on the rugby pitch, oddly enough, I slipped a number of discs and there wasn't an accident. There's no rhyme or reason to it. It just happened one day and it was excruciating. And I've been told that it's familial. It's part of my makeup, yet nobody in my family has the same back that I do, if you will. And through that process of having to stop my movement, having to stop competing, there was weight gain and there was weight loss. And I went through 10 years of living with this pain and surviving it with the use of opioids, primarily Tylenol 3s. So 10 years into that, I have 3 spinal surgeries in the span of less than a year. And the third one was a fusion. I woke up in the worst pain ever. And literally, I've worked in healthcare on the industry side. And as Dr. 𝐒𝐂𝐑𝐈𝐁𝐄 mentioned, I've worked for biotech and pharmaceutical and medical devices. And I know infusion pumps better than most nurses. Let's put it that way. And I know how a pain pump works. And my pain pump was not working. And I sat there for 8 hours before they switched it out and got me a new one. It was so traumatizing. I'd already lived through 10 years of this. I now have to learn to walk again. I have a hematoma the size of a grapefruit. I've got home care coming in and out of my house once I got out of the hospital for over a month to change my dressing because I'm still leaking. It just was very it was demoralizing and I was humiliated. I had very little control of my life. And as an individual, I'm a very stubborn, willful individual, and I need to get things done. I need to be moving forward, and I really couldn't. For the better part of a year, I was struggling to be able to even move. And I got through it, and I had every kind of therapy, physical therapy, massage therapy, acupuncture. Pilates was extremely important for me and for my care. And I got strong again. I still needed opioids to help manage pain and sciatic pain in particular. And I'm still trying to climb my corporate ladder, which was very important to me after having a year of being able not to move. This became the most important thing to me. I defined myself by my career. I pushed the limits of it. I, did everything I could to make sure that I was the best. I was promoted and moved to California to our head office, and did the same thing there. We had our son 5 years into that journey, and we needed to move back to Toronto. While I was in California, I had great insurance, so I had great access to whatever providers we needed. They switched my opioids. They put me on Tylenol 4s. And then we had some hydromorphone that was introduced for certain situations. I moved back to Toronto after our son was born, and continued to utilize opioids and therapies, physical therapies to help manage my pain. We moved a lot. I traveled a lot. At that point, I was starting up a new company, bringing a company to Canada, and I was traveling constantly. And every time I travel, it hurts. It hurts to walk. Like, airports might as well be ginormous mountains. That's what it feels like to have to walk through an airport to get to your terminal. It is so excruciating when taking, one step hurts, and you've got to take, 4,000 to get to your gate. But that's me. I'm willful, and I define myself by my career, and it's very important to me. And 2 years into that, our son was diagnosed on the autism spectrum, and it stopped our worlds. And we did our research, and for him, the best care was in Calgary. And so we put him on basically my husband, my son, and his aide moved to Calgary. And I said, just get him there, get him where he needs to be, and I'll figure myself out. And for the better part of a year, I was back and forth every single week traveling. I was 3 days here, 4 days there, just constantly. And it was very difficult. At the same point, my company was acquired. And from that point, the new firm they created a new position for me in Calgary. And it wasn't the same. It wasn't the same company. It was a position that was something I had done 5 years prior. It really impacted my self-esteem. I just really struggled with the fact that I have a child that has a special needs, and how am I going to be there when I'm traveling constantly? And it was overwhelming. We also suffered 2 significant family losses, and the depression set in. Like, it just set in, and I couldn't move. And so when you see 20 years of coping, at that point, I had one thread left, one. There just was no other option for me. And so I really needed to take a look. And I'm having the same problem that Guy had. It's not moving my screen forward. He just came out and shared it again, right, to fix it. Okay, let me try this again. Share. There we go. And go through. Okay, that's working. Okay, So it left me taking a leave of absence from the one thing that I held dear to my definition of self. And it was very difficult. But you talk about individuals living with pain and how resilient we are. I needed a solution. I needed an answer. So I'm 2 years in. I'm on my 6th GP for various reasons. And she said to me, you know, you've gone through a lot. Clearly, you know a lot. It's 20 years and you know yourself better than I do. There's this idea I have, and let's talk it through and see what you think. There's this program called the Opioid Deprescribing Clinic down at the Sheldon Schumer here. And there's this doctor, I think his name is Dr. Tange, Dr. Tangwe. I'm not sure how to pronounce his name. I've never met him, but I think it might be something for you and I to both learn about and see if it's an option. And she was willing to do this with me, not to me. It was my choice, and I had nothing to lose. It had been 20 years. I had one thread left. And so we did it. I went, I did an info session. I still have that presentation, Rob. It was fantastic. I disagreed with half of it in the moment. That being said, we moved through it. And the first time I met with Rob, he said this to me: I'm not telling you it's going to be easy. I'm telling you it's going to be worth it. And when we talk about what resonates for different people, it's different things. I had one thread left. I had nothing left to lose. And here's this person saying it's going to be worth it. Nothing was worth it. Nothing was worth it, you know, for me to be going through all of this pain. Everything in my life had stopped. I was struggling. And, you know, I think about what Guy just said. It's hard to do any living when you're busy struggling to survive. And that's where I was at. And so somebody offering me a lifeline saying it's going to be worth it, it's a game changer. So I wanted to walk you through what my journey had been like and what that looks like. So the first example that I have is I was walking in with multiple opioid prescriptions, multiple ailments. You heard me talk about depression. I didn't know it at the time, but I also had PTSD, very high doses of medications to the point where I was 7 times above the recommended daily dose per day. I had zero consistency in my life. Eating, sleeping, mood, concentration, my patience, my energy. All I was angry. And for any psychologists or psychiatrists, you know that anger is, it's not what it is. It's usually hurt. It's usually sadness. It's frustration. But I was angry. And so Dr. Reeb's comments earlier today are very validating for me in knowing that all of this medication over 20 years and the high doses I'm on, and all I could do was feel anger. I had zero patience. You know, why isn't dinner cooked? Why did somebody fold my laundry this way? Like, how dare they? I didn't have any brain elasticity to understand that I was behaving in such an angry way, and I couldn't manage it myself. So this lifeline, I said to Dr. Tange, you know, like, I do things and I commit. That's just who I am. I'm willful, right? So I want to start this taper and I want to do it fast. I want to be done in a month or 2, and that's just the way it's going to be. So let's get going. And very kind of him to let me start that taper and start off of what my current meds were. I think the important thing to note was that he took over as the prescriber. My GP, who was learning about this, could learn from him, but he managed, he was driving the boat. I needed to be starting for my own benefits multiple biopsychosocial therapies to manage my high anxiety, to manage my depression, to manage the sleep. Going through this process, there's a clinical approach to going through this, and then there is a very mental one that you go through as the patient. And they're two very different situations. So having therapies like cognitive behavioral therapy, having dialectical behavioral therapy, being able to have my family be able to ask questions and get answers to understand what I'm going through and how can they support me better and how can I support them better. Being able to do a lot of those things gave me tools so that we could do this in a collaborative effort as a team. And it gave me an opportunity to really take a look at doing things in parallel. I'm clinically changing my protocol, and I'm mentally changing it. And I'll talk a little bit about the difference between the two in a second. From that point then, we started to move over to Suboxone. And I had 12 hours where I didn't have any of my prior opioid and moved to Suboxone. It was 2 milligrams hourly up to 16 milligrams, but after 12 on that first day, it was enough. I was fine. And I felt like, okay, anything more than this, and I'm gonna feel shaky and just not like myself. And that was fine. And I stayed on that. We utilized blister packs. It was my pharmacist, I'll get to him too in a minute, but my community pharmacist was a godsend. And he helped, he supported this. He was part of the team from day one. And so we did this slowly. And again, I think back to Dr. Reeb's comments earlier today about if you go too fast, it can have negative impacts. But remember, I'm willful and I want to go get this over with. And so I pushed the envelope and moved to 8 milligrams, and the pain increased. And my body could not handle that. I was moving it too fast, and I was doing that. And so Dr. 𝐒𝐂𝐑𝐈𝐁𝐄 and all of his guidance said, you know what? We need to normalize you back to 10 milligrams. Let's just do this for another week. I know it's important to you that we move quickly. Sometimes you got to go slow to go fast. So we reverted, and eventually I was able to go back, obviously, from 8 milligrams and can continue to go down from there. The other thing we did was we introduced amitriptyline. It supported my sleep and it helps reduce my anxiety. And eventually we moved to Butrans patch. This should be sounding very similar to what Dr. Reeb was going through as her explanation. It's literally was reminiscent for me listening to her. But I moved to a 5 microgram Butrans patch and eventually transitioned off of daily opioids. And during that time, after we stopped using the patch, we introduced clonidine and clonazepam for a short period of time to help with any residual withdrawal and to help with any of that anxiety. I could take Tylenol and Advil together if I had pain. And somebody from, you know, before starting this, if you had said to me Tylenol and Advil, I would have told you were crazy. There's no way those two are going to add anything when I'm on all of this other stuff. And yet today I can still take Tylenol and Advil, and it works better in most cases for me than how I was getting relief with opioids. I still have an opportunity. Opioids are still in the industrial sized garage. It's still an option, and I have flare-ups. And I have bad flare-ups, and they can last. And so I have an opportunity to take a maximum of 4 Percocet over 7 days. And every time I take one, it works like the first time every time. That's my experience. My threshold for pain was non-existent before I started this. Now I can manage so much more. I have so much more brain elasticity to be able to consider my options. I have like 107 different things I can do that help me distract and take away from me thinking about my pain. And I've been able to retrain my brain in order to be able to do that. And that's why I like the concept of the brain as a bunch of puzzle pieces, because they were set up in a certain way for 20 years. We, mix them all up and put them all back together in a different way. And it works for me. For me, it's a better option. And I think one of the things that I mentioned, obviously, was my pharmacist. So please meet Mohammed. He's my community pharmacist. I want to talk a little bit about the emotional and the mental journey. So these pictures are from Friday, like 2 days ago. And 2.5 years into this process, I was finally able to move through the anxiety of letting go of opioids. I had a stash of over 700 pills, most of them long acting, that if my son got his hands on even one of them, probably would send him straight to the emergency room. It just was very difficult for me to connect the two between being a mother and keeping my house safe and living with the anxiety of what if it comes back? What am I going to do? The answer is I have a plan with my GP. I'm going to be in touch with her. I'm going to be able to take opioids, and she's going to be able to get that prescription to my pharmacist very quickly. He's going to be able to help me as a prescribing pharmacist if there's an emergency. We worked through this plan to help my anxiety so that I could relieve my family and my household of these meds that if I were to take them today would probably kill me. So the journey is a constant evolution. Like I said, 2.5 years of that. And just to go back to this slide, you can see my anxiety levels in red and where they were at. They were super high. And again, relating to Dr. Reeb's presentation, of course they were super high. And when you see my quality of life, it just evolved and things felt different. The colors in the sky looked brighter. For me, it was a better option to remove all of this opioid weight from my life. I still use them. They're still in my industrial size garage for all of my tools. They're still there. They need to be there. They have a purpose. For me, I needed a different approach to my therapy. So it doesn't matter how slowly you go, as long as you don't stop. Again, I'm willful and I have to go fast. And, 2 months expectation turned into 8 months of reality. Others in my peer group that went through these courses with me, some did them in 3 months. Some did them in 3 years. Everybody's different and your body normalizes at a different rate. And you have to recognize that. I wasn't going to be Superwoman in this instance, and that's okay. So as slow as I needed to go, and again, I'll put in another quote from Rob, start really low, go really slow, but just go, just keep moving forward. Even if you have to go backwards from 8 milligrams to 10, it's okay. You're still moving forward. You're still better than you were yesterday. And it takes me to the linguistics of it all. And this has been talked about all weekend long. I'm so impressed by that. I didn't expect that. This slide was written before I even started, or before the conference even started. But the importance of linguistics as a negotiator is significant. And the concept of but versus and. I try to use the term and as often as I can, because multiple things can be true at the same time. When you use the term but with a person with lived experience, it can be invalidating. It can talk about the concept that what you just said doesn't have any more relevance because I'm about to say something different. So and is a really important term that I like to utilize and I like to discuss. All of these words on the screen all have different meanings. Taper versus deprescribing, I got to tell you, as a person with lived experience who's gone through deprescribing, someone who is on the level of opioids I was on, like, you couldn't find a more horrific, scary term than to use taper or deprescribing. You're taking my lifeline and you want to get rid of it. That's what it sounds like. That's not what it means. That's what it sounds like. So just like we're trying to change how we communicate and terminology around catastrophizing, I really think we need to take a look at these terms as well and consider our options. Pain versus frustration, they both can be true. I was living pain, physical pain, and I was living emotional pain, and they felt the same. I didn't have the elasticity on all the opioids to be able to differentiate between what was my physical pain and what was my emotional pain. It felt the same way. And that takes me to, it's in your head versus you are feeling this. Of course it's in my head. That's where we receive pain. I know that now, but I didn't know that then. And if someone had said that to me, completely invalidating, and as opposed to saying, yes, you are feeling this. You're absolutely feeling this. And let's talk about that. Patient versus person, obviously we're all individuals, and you know, the concept of an individual with lived experience is just so much more ingratiating than the concept of being a patient. It means there's something wrong with you. I'll just go through one more in terms of exercise versus movement. This is something that I struggle with. Exercise to an individual living with pain it's just not the same. It's not a term that you can use from my perspective that is supportive and validating. If you talk about the concept of movement, absolutely. So just some things to think about in terms of how we communicate with each other. And whether you're a practitioner or you're a person with lived experience, we need to be respectful and supportive of each other, because we're both trying to achieve the same outcome. We want to help, we want to support, and we need more options to fill our industrial sized garage. My ongoing acceptance is it still happens today. It will happen for the rest of my life. What I can talk about is how I'm through this process learning and relearning myself. I know I'm willful. I know that I come with trauma and depression. I know I have a learning disability that changes how I receive information. I know I have a family history of alcoholism. I know I'm a very creative person. I know I'm driven and motivated and stubborn. But before, those were all things that were individualized. I didn't connect the dots, and you heard me talk about how my career is how I define myself. Going through this process mentally, it gave me an opportunity to look at the frustration, the anger, to delineate what was the physical pain, and to build brain elasticity and capacity through these cognitive and dialectical therapies, as well as through ART, so that I could become a whole me. And I think that's the point that I'm trying to get to, is remembering I'm a whole person. I walk in to a doctor's office as a whole person. And I wasn't able to see myself that way. It took this process for me to be able to evolve to it. But I'm grateful that I had this opportunity. It's not something I would have had in California. It's not something I would have had in Toronto. And so when we think about, you know, the why in the world, I was here for a reason, and I just needed to reach out. And that process of re-education is really important. Pain is still constant. I have it every day. I have it now. I cannot sit. I personally cannot sit for 3 days and not feel pain. It's not an option for me. But I have, as I said, and I've counted them, 107 new ways to deal with it that have dramatically increased my quality of life. And I can think differently about it. I have been able to retrain my brain to think about it differently. And so it's really important to think through, you know, what you're trying to achieve for your future. Your dream doesn't have an expiration date. I can still have an amazing career. Because of this process, I've been able to go back to work and do what I love to do. And I can still achieve my goals, and I still have pain, and it's okay. And so that kind of takes me to my next point, which is, and I love this quote, I use it often. Today was going great until people, like, and you heard me talk about frustration, and frustration for me manifests as pain. And me being able to delineate between physical pain and emotional pain and what that looks like. So this is a visual of what that feels like for me. I have pain, it's dialed up, and the world happens around me. You know, I'm in the grocery store and someone's taking way too long to pay for their groceries, and I'm in pain. It's 6 o'clock. I was supposed to have dinner started at 5. Let's go, people. And, you know, I start to feel pain. I start to literally, my sciatic starts to move, and I have to say, you know what? I understand that pain. I recognize you. It's okay. And you know what I'm going to do? I'm going to keep moving. I'm going to keep moving while I'm waiting here in line. And if I have to, you know, dance around and keep my body moving and my leg moving, that's what I'm going to do, because it's better than me becoming angry. And there are things I can do. I'm standing there in the grocery line. I can get the hottest cinnamon gum ever and stick 3 of them in my mouth and chew it. And trust me, that'll change my thought about what was going on with my leg. So those are things that I can do. And the other thing I do is I really take a look at, and this can be hourly, minute, daily, whatever it is. What are my priorities? Everyone knows the concept of putting the big rocks in first. Everything below that red line wasn't even a concept. I never thought about it pre going through this program. And now I'm at a point where they become pretty much, outside of being a mother and a wife and maintaining my career, they're the most important things to me. And I have to be able to recognize sometimes being health or putting health first means I just need to take a 5-minute mental break. And that's what it means. It can also mean, you know what, I just need to call my friend and have a discussion about whatever happened today. It can be different things. I know they're big words and they're big buckets, but they can be really small things that you reassess. What is my priority today? And sometimes my priority is only being a mom, and I have to make a lunch. He needs a lunch, and that's the priority that I'm doing, and it's going above everything else. So to finish off, looking back, what did or what do I need as an individual living with pain? And one of the things that I've recognized is I have to be able to talk about all the things in my life with my therapy team, not just my physical pain. And, you know, when you walk into a therapist's office and they say, okay, you're here to talk about your pain. Everything else, you know, you need to put aside. We're just talking about your pain. That's not addressing me as a whole person. And you've heard me talk about anger and how that manifests into pain for me. And when things are frustrating, it's pain for me. And I need to be able to talk through that. I think the other thing too is to actually feel supported. We heard earlier about the concept of, you know, people can see really quickly when someone's being disingenuous. And you have to feel supported, not pressured, and not left to my own devices or shunned. If you get a flare-up, what am I going to do? I have to be able to walk in and say, I had a flare-up. I've taken 2 more than I should have from a normal scenario. And we need to make sure that I've got what I need for tomorrow, whatever that looks like. And do that without blame, without guilt. I have to be able to challenge my therapy team and accept, because I'm willful, accept challenge from them. And I think that's really important. This is a 2-way street. So I'm asking for support, and I need to be able to listen and let my practitioners be heard. I have to feel like my voice was heard and not dismissed. Most importantly, we're doing this with me, not to me. It's my choice. We have options and we have choices. I've now got an industrial-sized garage that my therapy team and I are going to help reinforce that it's my choice, and what's going to work for me isn't going to work for everybody else. But I got a lot of options because of this community and everything that we're all doing to make life better. And the last thing I think is really important, I need to be able to pause certain aspects of my life. For me, it was pausing my career so that I could focus on all the other parts of me as a whole person. That being said, sometimes it's relationships, sometimes it's friends, sometimes it's, you know, your nutrition, and you're so focused on, you know, eating healthy in a certain way, and it's just getting in the way, and you need a minute, just need a minute to reset. And so I think when you think about what are all the beneficial things in your life and what can you focus on, what elasticity do you have to be able to focus on? And that goes to what big rocks are we putting in? Sometimes you have to say, you know what, this friendship isn't working for me right now, and I can't handle that. I've got to focus over here, and that's okay. And being able to communicate that is okay. So with that, I'll just finish by saying that failure, being a very willful person that wants to do things faster, sooner, and have, you know, zero patience for anything, it's not the opposite of success. It's part of the journey. And I'm on a very successful journey. This has worked for me. I'm grateful for that. It wasn't an option I would have had I not moved to Calgary, and I'm grateful for it. And I'm grateful for this community, the fact that this weekend I have learned so much. I continue to relearn. I'm grateful for everything that the Pain Society is doing. This is unprecedented with the amount of patient inclusion and engagement. Thank you for that. And with that, I'll turn it back over to Dr. 𝐒𝐂𝐑𝐈𝐁𝐄.